A really great panel with us today to talk about this pressing topic, which really has far-reaching ramifications beyond just the western region of the state, as the struggles and challenges facing Health Sisters Hospital System and Prevea Health are struggles and challenges that rural health providers across the state and across the country are also facing. So I'm really looking forward to today's discussion, and I'm honored to introduce Emily Berge, President of the Eau Claire City Council, Dr. Richard Helmers, Regional Vice President of the Mayo Clinic Health System in Northwest Wisconsin, Dr. Brian Hoerneman, Interim CEO for Marshfield Clinic Health System, Senator Jesse James, Mike Sanders, Lead Advisor for the Chippewa Valley Health Cooperative, Kaylynn Winegar, Vice President of Investor Engagement for the Eau Claire Area Chamber of Commerce, and Sean Kirkby, Senior Editor for Wisconsin Health News, who is moderating today's discussion. Sean is the lead reporter for our daily email newsletter, where he has been covering this topic exhaustively. But before we get started, I want to make sure we thank our generous sponsors of the Wisconsin Health News virtual series. We really view these events as an extension of the journalism that we produce in our daily email newsletter, and they would not be possible without the generous support of our sponsors. So a huge thank you to Aurora Healthcare, AARP Wisconsin, Anthem Blue Cross and Blue Shield of Wisconsin, Gunderson and Bellin Health System, Hush Blackwell, Quartz, and the Alliance. Wisconsin Health News is an online, nonpartisan news service. In addition to hosting events like these, we also publish a daily email newsletter. So if you're not yet a subscriber, I encourage you to sign up for a free trial, which you can do on our website at wisconsinhealthnews.com. And I want to give an extra thanks today to Anthem Blue Cross and Blue Shield of Wisconsin, today's featured sponsor. We are really grateful for all of their very generous and continued support. And here to say a few words is President Paul Noble.
Great. Thanks, Tim, and good afternoon, everyone. Hope you're having a great day. I think many of us have expressed some disappointment and the challenges related to the HSHS and Prevea announcement. While the challenges of healthcare are many, the opportunity to address and improve both access and quality rests with all of us. So I'm really excited about the panel discussion and to hear from the other experts this afternoon. Before I start the panel, I just want to share a little bit of what Anthem Blue Cross and Blue Shield has been doing to address the issue. I want to start first by mentioning our members that having access to top quality care is a top priority for us. I want to make sure our members understand that they are our top priority during these difficult times. Some of the things that Anthem's been working on really starts with the leadership team and the clinical team. So we've been engaged with both leadership and clinical leaders from HSHS and Prevea and frankly, others on the panel this afternoon to help identify impacted members, in particular those that are of highest risk, and determine how we can help those members transition to new care providers in an effective and efficient manner. Again, having access to high quality care for our members is a top priority. One thing I would point out is we have an extremely broad network in this particular area. So within the 10-county area, there are still, after the exit of HSHS and Prevea, there's still going to be over 6,000 care providers. Again, many of the panelists represent some of those health systems and provider systems, so we're grateful for the work that they're doing. I want to remind people that there's tools and resources available. So the Sydney Health app is a great tool for Anthem members to gain access to virtual care for both behavioral health and routine care. It offers 24 access both virtually, telephonically, and through chat. The other thing I want to point out is that we are offering clinical assistance to transition particularly at-risk members into other care providers within the network to make sure there's no gaps in care and that they understand what options are available to them. Simple way to gain access is go to anthem.com, or if you're an Anthem member, you can just dial the 800 number on the back of your card. Lastly, I would share that we do have case managers, so nurse case managers that can offer assistance, and they're part of an interdisciplinary team of clinicians and caregivers that offer resources, again, from behavioral to primary to acute or chronic conditions. Again, you can access that resource by simply calling the 800 number or going to a website. Lastly, Tim, I'd share, we've created a website that dedicated to address the issue. So any of the information and the most recent updates can be found at anthem.com/HSHS Prevea closures. So if you want additional information, you can go there as well, and we'll keep that website as up to date as possible. So I want to thank the panelists. I want to thank Tim, and I will turn the discussion over to Sean. Thank you.
Great. Paul, thank you so much. And then thanks again to Anthem for all of the generous support. Sean, take it away.
All right. Thanks, Tim, and thanks, Paul. In January, Hospital Sisters Health System and Physician Group Prevea Health announced their plan to exit Western Wisconsin. HSHS hospitals in Eau Claire and Chippewa Falls will close Friday. Prevea Health will close its 19 clinics in Western Wisconsin in the coming months. The two providers, which declined to participate in this discussion, so they're making a decision, quote, after prolonged operational and financial stress related to lingering impacts of the pandemic, inflation, workforce constraints, local market challenges, and other industry-wide trends. Our panelists will take a deep dive into what this decision means. And I'd like to start with Kaylynn first. The Eau Claire Area Chamber of Commerce formed a task force to respond to these closures. And last week, they said the decision to move up the Eau Claire hospital shutdown date to Friday made the situation even more of a crisis. Can you elaborate a little bit on this? I mean, what does this mean for the Chamber's response?
Yeah, so very, very shortly, within 24 or 48 hours of the initial announcement just over a month ago, is putting this task force together. We very quickly had over 200 people who said yes to helping with this challenge for our community. And I'll be honest, I don't think there's a single person who understands the full scope of what this will mean for our region. However, we're fairly consistent in the fact that every single person at this table is here for the focus of the patients who are dealing with this challenge. And so that's what we try to keep first and foremost as we work through all of the task force committees that have been formed, and of course, all of the partners that are here at the table today. One of the very first committees we convened was under patients' needs and concerns. So what is the care that will be needed with these closures, and making sure that we can cover those, whether it's existing business, new business that needs to come to the area, or innovative approaches. And so that will just be a long-term project that we're consistently working on to make sure that that care is covered as much as possible. And then business effects, is there new business that can come in that we can help streamline or take down any red tape for them to create care for those folks who need it. And of course, the jobs as well. We want to make sure that the trained healthcare professionals that exist in our community can stay here if they choose to stay here, and that we can retain that talent because it's desperately needed here. So a great focus on the employees, and we've had great partners with the state, making sure that we can retain those folks as much as possible. Public relations is another piece of which we're trying really hard to focus on, and helping folks empower their healthcare journey, whether that's prevention or finding new care within systems that already exist, or breaking down transportation barriers if that's what it takes. But the individual stories that we're hearing from patients, and making sure that we can break down any of those barriers, if at all possible, with all of the experts that are on the table, have been critical. And I know we'll hear from some of the counterparts here, but certainly talking to all of our partners with the current hospital systems, new and existing business that comes here with those innovative approaches, and then our government officials as well, who have been incredibly responsive, and we're very thankful for that. We are working with our city and county officials as well on business redevelopment and financial resources, if that's what it takes to bring new business in to help cover mental health therapy that might be needed for folks, or cancer patients, OB patients, all those folks who are dealing with those really, really critical issues right now as we have this impending closure on Friday.
Thanks, Kaylynn. Dr. Helmers, is Mayo Clinic ready to handle the surge of patients that could come with the closure of two emergency departments in this region?
So thank you for that question, and thank you for putting on this symposium today. One of the things that I want to remind people is that we were at capacity even before any of these closures occurred. However, what we have experienced and what we've said is that we are committed to caring for all patients with serious emergencies that present to our emergency room. And certainly we've seen an increase in the number of patients coming to our emergency room. And those that have serious issues, such as heart attacks and strokes and that sort of thing, we have accommodated, so that we will continue to prioritize care. And so we are dealing with the increased volumes in the emergency room as best we can, but certainly want to assure people that medical emergencies we are indeed seeing and expecting and caring for.
How about Marshfield Clinic, Dr. Hoerneman? How are you guys preparing for a potential increase in patients in ERs?
Yeah, for ER specifically, so I'm actually an emergency medicine physician, so it's an area I've practiced in for about 20 years. And we have a little different model in our ER in the Eau Claire area. So our ER in Eau Claire has been a combined ER urgent care, and we're doing a couple things there to increase the capacity. So we're doing some facility changes there that will help improve our triage process, as well as some of our fast tracks. So some of those patients that aren't quite as sick, and that those can be moved through fairly quickly, so people don't have longer waits. We're also working to open an off-site urgent care. So in Lake Hallie, we'll be opening up an urgent care to take some of that urgent care volume out of the emergency department. And similar to what Dr. Helmers was noting, to have the emergency department be there for those very sick patients, for those that need it the most, and hopefully be able to then have that less acute patient, those that aren't quite as sick, either be seen in urgent care or in their primary care offices. And we're also working with our primary care folks to increase the number of same-day access appointments that they have. So we're adding about 50 additional same-day access appointments in that same vein of trying to offload the emergency department as much as we can and prepare for that increase in patients.
Thanks, Doctor. Mike, the cooperative is working to kind of respond to the situation. Does moving up the closure date of Sacred Heart by a month have an impact on that work? And how are you all grappling with that?
Well, clearly every day makes a difference. And this is an urgent crisis that kind of came not out of nowhere, but certainly with much surprise to everyone in the community. The cooperative is 3 weeks old. So it's arisen out of a group of community leaders who want to make a difference and develop a community-based response with local decision makers deciding the fate of healthcare in the Chippewa Valley. So I think it'd just be helpful, a little background. I initially got pulled into some work up there by the Oakleaf Medical Network, which is a very large independent association of physician practices, more than 170 practitioners. So when this occurred, most of those physicians who had hospital-based services and did hospital-based procedures were losing their access to care for their patients. These two hospitals were 40, depending on how you measure, ER volume, inpatient care, dollars, staffing, it's roughly 35 to 40% of the healthcare that was being delivered in the Chippewa Valley region as late as 2022, which is the most recent statewide public data. So this is a huge loss. And most of the network physicians practice at these two hospitals. So they initially kind of called me with a request. We know clinics, we know healthcare, we don't know hospitals. Can you help us take a look at options? Initially, the options we looked at were working with HSHS. Maybe there was something we could do in partnership, a transition, kind of anything was on the table if we could reduce the gaps in healthcare for the community. And that didn't really work out. HSHS wasn't interested in talking about any of those potential solutions. So then kind of in a parallel and sort of next step, it's like, let's work with the community. And so 7 community and business leaders have stepped forward to create Chippewa Valley Health Cooperative. And we specifically chose a cooperative model to make this very community-based in terms of community engagement, community involvement, community say, local say. So we are a nonprofit. We are in the process of applying for 501c3 status. So this is a nonprofit approach, locally driven. So yes, every month makes a difference. And we're trying to do what we can to put together some options. So we're looking at a wide variety of options from outpatient services to address the things that are most going to have an impact right away, like cancer care and cancer treatment. We know many patients are going to be traveling out of town and for therapy that sometimes is daily for 8 weeks. That's just really unacceptable for a community the size of Eau Claire and the Chippewa Valley. So we're looking at that. We're also looking at long-term replacing inpatient hospital capacity. There's, I appreciate the work that Marshfield and Mayo are doing to try to step up the volume in ED and support the needs of the community. But the facts are, looking at numbers, it's too many eggs to fit in the basket. We need to replace that capacity at some level. And so we're looking at innovative, creative ideas that will be patient-focused and community-led to meet some of these needs. And we've only had 2 meetings. So our first meeting was 10 days ago or so, or 12 days ago. So I don't have a plan or a picture to show you here, but I can tell you the community people involved in this group are very engaged and very passionate about trying to develop some community-based solutions. And the physicians of Oakleaf Medical Network, which are a third of the medical community, a third and growing, because I know they're being approached by many of the Prevea patients, or not patients, physicians looking for a home, as I'm sure Mayo and Marshfield are too. It's like people want to stay in the community, they have patients, so we're trying to help them too.
Thanks, Mike.
Sorry for letting me go for a long answer, but I just wanted to kind of set the perspective of who we are and why we're here. So.
Yeah, no, I appreciate it. And we'll get into some of the things that you mentioned a little bit further into the panel. I wanted to circle back to Council President Berge, and was wondering, can you talk a little bit about what you've heard from your constituents about the move update for these closures, and what are sort of their concerns?
Well, I think if I could just back it up to when the first announcements first was released, I mean, it was a shock, I think most of us here, if not all of us at this panel, and probably everyone that's listening in, people had no idea. I found out by text messages from friends who, I'm a counselor in my day job, actually, at LPC, and they found out some of these former colleagues that they lost their jobs, and that's how I found out. I'm like, whoa, and it just, this shock wave went through our community, and there's a lot of grief and loss, a lot of anger of our community of how can this happen? They look to Eau Claire, and I don't blame them. Like, could we have prevented it at the city, or we couldn't have? But like, they're just a lot of sadness and just grappling with what happened. And people found out that they're going to lose their job in a couple months. People found out that they lost their providers or will be. It's just really, so I think people are still almost dealing with that first announcement, because it's not that long ago, 6 weeks ago, where we were all just hit with that. So the move up, I almost think people are still reeling from the first announcement, that I'm sure I just haven't heard a lot since the most recent announcement. But I know it's still impacting, and people are trying to figure things out. Like, okay, now where do we get health insurance if they had their health insurance through Sacred Heart? And where am I going to deliver my baby now? And I heard one story how one woman was discharged that Monday on hospice with Sacred Heart, and then they called her that night and said, sorry, so she has to figure that out. So it's like this emotional part, and then this actually like figuring things out on a personal level. So it's a lot for our community.
Thanks for sharing that. Senator James, could you talk a little bit about what you're hearing from constituents about this? And you represent the Chippewa Falls area, which is now losing its sole hospital. What have been the concerns there?
Well, yeah, it's obviously devastating to the entire region. There's so many things that pop up when this occurred, things that typically you don't think of until you hear it from the people. Like, now Chippewa County doesn't have a morgue. myself as a law enforcement officer, I don't have the blood draw services available now, and we'll have to either go to Ladysmith or to Eau Claire for a blood draw for a OWI arrest. You hear the impacts of even the Prevea urgent care centers and the medical doctors, the medical directors there being gone, and they're the ones that prescribe medications to our adult living facilities scattered in the rural areas of the region. There's so many things and so many people that are impacted by this, the delay in EMS response with our ambulance services now. The list just goes on, and really it's hard to comprehend the impact, the overall impact that this is going to have on Chippewa County primarily, and then Eau Claire County and the region itself, because there's so many services that were there, and in a matter of a few days, they're going to be gone.
So, Senator James, I'd like to stick with you for a few questions. You authored a now enacted state law that would provide $15 million to support hospital emergency department services in Chippewa and Eau Claire counties. Can you talk a little bit about why the focus on ERs and capital projects?
Well, I think the number one thing was, I feel as a legislator, we need to ensure the most basic of services. And with Chippewa County being the most impacted by the closure of St. Joseph's and in the emergency department itself, that's a department that is probably the most utilized and has the most patients where unexpected things occur. With other services that are available, you have some remedy and support in place, and the foundations are there already. And this was a concern that was brought up by a number of Chippewa County constituents, Chippewa County government, police, fire, EMS. This is going to be devastating as far as the public safety response. I'm concerned as a law enforcement officer on how long it's going to take for an ambulance to be arriving on an EMS incident that I'm a part of. So I think having those services stripped to where you're not going to have that ability or capability anymore, whether it's emergency departments or urgent care centers. We have the Bloomer Hospital and the Stanley Aspirus Hospital, but those are not admitting hospitals. So there's obviously huge concerns for big picture. And I think that having those services, having the most basic services available for the people that are in need, because we know a lot of the population still uses our emergency room departments. The statistics show that we had 22,000 patients that used the hospitals, Sacred Heart and St. Joe's last year. So that's a lot of people.
So Governor Evers made some tweaks to this plan. The dollars are now kind of in control of the legislature's budget writing committee, but he's objected to spending them on those services and would like to take a more regional approach to this and cover additional services that might be affected by these closures. Are you asking the Joint Finance Committee to continue down this path of supporting ERs, or are you open to having these dollars hit to other services and potentially other counties that are affected by these closures?
Well, so again, this is all part of the political process that we're a part of. I voted for the expansion of services on the Senate floor when the amendment came up for the legislation. My other Republican colleagues did not. This is part of the process that we go through in the legislature in garnering support for these funds to be released. We have to get the support in place first. And I think when that strong veto pen comes into play, it definitely can ruffle feathers. And this now has become a sticking point, as well as you hear already with the HSHS funding dollars not being released, tied in with PFAS, and we just don't have room for this. There are discussions taking place as far as what can be dealt with to where there's not so much heartburn and put in place. But again, it comes down to effective compromise and negotiations.
So when it comes to releasing these funds, are you working with any providers or any groups on putting together a plan for the release of them? And what does that kind of look like?
So I know the task force has this group of 15 entities involved with their expansion of services for our area. We need to have discussions. I would like to see a plan. I still have not seen any plans. And I think that's part of the problem. I think if we can see a plan and we can get it shared amongst our Republican colleagues, especially on Joint Finance Committee, saying, hey, this is something that we can definitely support back at home, especially more so with my Assembly colleague, Representative Rob Summerfield. And then we go and have discussions with Representative Mark Bourne and the Speaker and say, hey, let's get this out. This makes sense for our area.
And you've mentioned some of the requests the governor has put forward. Do you have any idea what a timeline would be for releasing these funds? Are we talking weeks, months?
Well, I think it depends on the 1310, the date of the filing of the motion of 1310, which is to get the Joint Finance Committee to act or request to act, and then also getting the support from our colleagues down here in Madison to say, let's go forward with this, green light go.
Got it. Thanks, Senator. Dr. Helmers, could you weigh in on this? What would you like to see this funding go to? Do you support it heading towards emergency room capital projects?
Well, thank you for that question. And we certainly want to thank all of our government officials for working hard to make these funds available. One of the things to remember is there are areas other than the emergency room that have also been significantly impacted by this when we've talked about the increased number of heart attack and stroke patients that we've had. So there are other areas that could potentially offload or improve the situation in emergency rooms other than just emergency rooms. So that it's premature to discuss, but we are working on a proposal or several options for proposals, depending on what news we hear about what sort of projects would be accepted for being looked at. But so I think to also remember that it's not just the emergency room certainly is impacted without a doubt, but other areas have been impacted as well. So that, again, want to thank our government officials for hopefully making these funds available to us. And I think that you'll see probably from Marshfield Clinic, our colleagues there as well, that we would have proposals that we would submit for that.
In terms of that, if these funds don't move forward, is that going to cause a major issue for you all?
It certainly would make it easier if the funds were available, but we certainly we're assessing what we think are kind of where we reach an equilibrium as to what the increased volumes that we're going to see is. And then we may need to, work on expansion proposals of our own.
Thanks. Dr. Hoerneman, could you weigh in on this? What would Marshfield Clinic like to see done with these funds? And are there concerns about them not becoming available?
Yeah, thanks, Sean. So yeah, some of the challenge behind this has just been the speed at which everything has happened. And so pulling together that kind of comprehensive plan and getting things from day to day to more of a longer term planning perspective, it just takes time. And it's been great to see the support and response at the state level to get things through that quickly. Do you have those dollars that have now been designated for the region is terrific. We've had to, just given how fast things are transpiring, we have taken steps already to do some modifications on our facility. So I mentioned we're modifying our ER for triage capacity in that fast track area. We've also expanded our OB unit by about 13 beds, and that's required some facility changes and some cost associated with that. So we are moving forward with that. Now, the state funding does help us then further expand that capacity. So we have an additional phase of emergency department capacity that could add additional 6 beds to our emergency department. We're looking at that. But there are many needs in the facility. And as Dr. Helmers noted that, it's volume that would be increased throughout the facility. And our urgent care volumes will be increased as well. It's really a good start, the 15 million. It doesn't address all the issues, of course, but it has been really nice to see the state support the effort.
Kaylynn, I know that the Eau Claire Chamber has been involved in advocating for this. Can you talk a little bit about what you see the money could be used for?
Yeah, I mean, I think that our colleagues have already done a really good job of highlighting in which ways they could use those funds. Our biggest push has been one, a thank you for at least making the funds available in the short term. And then of course, trying to get the word out that proposals will need to be made in order to access these funds, whether they're in part funding or full funding with the 15 million. But the biggest thing is that we need to use the 15 million. And that really does put us in a really sticky spot politically, because we want to make sure that, yes, it's its best use, but if we don't use the 15 million, we're gonna have a really hard time going back to our state or to even out to DC to ask for additional funds, of which will desperately be needed for our region.
Thank you. Mike, I was wondering, does the cooperative also plan to seek some of these dollars for its work?
Yes, absolutely. And I just want to comment on Dr. Helmer's comment. I agree 100%, and Dr. Hoerneman too. There's more than emergency departments that are at stake. And I applaud the senator. He had his numbers perfect, 22,000 ED visits at St. Joe's and Chippewa Valley in 2022. And but the emergency services is broader, and the emergency needs is broader than just the emergency department. And that's where I think the cooperative would be looking at the potential to be eligible and apply for access to some of these funds. As we look at the whole spectrum of services we're trying to evaluate, it's a little bit of need versus feasibility and timing and all that. And so if our long-term goal is to recreate some of the beds that have been lost, that hospital will have an emergency department, but that's not going to show up tomorrow. But there are services that there are gaps already in place and more after next week that we think we can address. And in that broadened view of emergency services, it's an emergency if a cancer patient has to drive out of town. If it's an emergency, if people don't have access to cardiac care, those kinds of things. So yes, we absolutely would be interested in talking with the legislature about access to some of those funds to serve the Chippewa Valley community in a relatively rapid fashion, not over the horizon 3 years, things we could put together within 12 months or sooner.
Thanks, Mike. Council President Berge, could you talk a little bit about the city's response and maybe your response to this funding being available as well? Is the city working with groups to, help boost access to care?
Yeah, we are. The city we're in an interesting position because these are private entities, and so we don't have a whole lot of control over private entities, and the city doesn't. So our role has been more convening, connecting with people. People do come, reach out to me as council president, looking like I have an idea, I want to help. So then I get them in touch with the chamber or our economic director at the city, and he knows other things, boots on the ground information. So it's really a lot of connecting with people. And so that's what we're doing. And then with the 15 million, I guess it's more about I think, well, it's interesting, this conversation so far, there's emergency. And then what I'm hearing is also, upstream, preventative approaches, which actually impacts the emergency departments. And so there's a need up there too, because if we prevent someone from, going to the ED, that will also be part of the solution. So I think I'm in favor. I applaud Senator Jesse James for voting for the amendment to make it more flexible, because I think that's what we need. We're still in crisis mode, and we need that flexibility. The private entities need that, our hospitals, nonprofits need that flexibility to really meet people where the needs are. Because there's maybe you all know if there's a plan, but there's really no game plan. We've never lost a hospital in Eau Claire before. Chippewa's losing their hospital, which is a huge blow to the community up there. So we just need as much flexibility as we can in that 15 million. just can do the most good, I think, if we're the most flexible and the entities can use it as they best see fit.
Just sticking with you for another question, can you talk a little bit about what impact do you think this could have on the city of Eau Claire? It's a growing city in the region. What are your kind of concerns about the long-term impacts of these closures?
Well, there's lots of concerns because, I mean, Sacred Heart and Prevea, they didn't close up because of a lack of, need. I mean, there was definitely people there. We still have medical needs, healthcare needs. So it's definitely still those needs for people in our community, lasting, so we already had, I think the gaps leading up to it from my viewpoint, was like rural healthcare is a huge gap, and then mental health was a huge gap, from my perspectives. And that just got bigger with this closure. I think those just got more wide. And so it's really directing, figuring out how can we close that gap. I think, so it's just gonna impact people, I think, in our rural communities. And then even and mental health, Senator Jesse James has talked a lot about like transporting people to different mental health, because if someone is chaptered, they have to be in a locked car to a locked unit so they don't hurt themselves or someone else. Usually that's the ED or a locked unit somewhere. And like people would have to go to Duluth even before, and now that just makes it worse. And these are family members here, then now they're teenagers down in La Crosse or in Winnebago, and it's a lot when you're already experiencing a mental health crisis to go through that. So that's another impact, just that mental health, those mental health needs. And so there's lots of, and then there's the employer aspect too, unfortunately, when someone lost their job, of course, they want to find a new job, and that might take them out of Eau Claire. I've heard, a couple doctors going up to Duluth or, to work up there. And that makes me sad because, I don't want to lose anyone. And but we are growing. We're still a vibrant community. I think Eau Claire will be great, but it's just sad losing those peoples and hearing stories about how this really does negatively impact people. And I think, as someone mentioned, we'll see ripple effects for years to come. So.
Thanks. Kaylynn, could you weigh in on this a little bit? What is the chamber doing to help bring in providers and make sure there's not this exodus of healthcare practitioners to other parts of the state or out of state?
Yeah, it's a slippery slope too, because as Emily was talking about, it's so individual for so many folks, not only the patients, but the folks who are working there, the families that it will affect. We are a growing community, and I'm very thankful that we've had that as a launching pad. We're also known for a very collaborative community, so none of the faces on this screen are new to us. We have regular conversations with all of these folks. I think that's going to be a really good testament to figuring out what the impacts will be for our growing community and making sure that we can support business or patients or employees or families the best way possible as we work our way out of this. And that is immediate need and crisis and triage, of course, but it's also at some point this summer, and even working with Mike, pointing the compass towards the long-term effects and really focusing on how can we come up with some long-term solutions for our community and all the different areas of which healthcare has had an impact. I am very thankful to have some really great contacts with the state. Our DHS partner, Deborah Standridge, has been sending us what I'll use as leads for the better part of a month of different organizations that have tapped Eau Claire as a place that they want to grow and expand their businesses. All of which are healthcare focused, whether it's mental health or substance abuse, wound care, oncology, in-home services that would really help cover even the rural challenges that we're facing. And so very thankful to be at the table to meet with all of those folks and hear their stories. The one thing that I think we've seen the most with all of these companies is that they all had Eau Claire kind of capped already because we were a growing community for Wisconsin as a place that they wanted to expand. With the announcement of the closures and of course, even the increase of them closing and getting less time, in those facilities, they've moved up those timelines. And so we've been really trying hard through the task force and of course with our other chamber partners in Menominee and Chippewa to send those folks into the communities where they're going to have the best impact and the quickest impact for the folks who are absolutely needing all of that care. So I'm very thankful to at least have all the partners at this table and then those continued conversations. We're also meeting with existing business, ones that have capacity in this area. And we're doing our best to put those up on our website as a resource and try to get patients that care and a place for them to go to at least ask questions and make sure that they can have that empowerment over their decisions in healthcare. Because, man, I can't even tell you, I don't know what I would do. 2 years ago, I was pregnant. If I got this announcement, I didn't know where I could have my baby, how stressful that would be. And so I think about that a lot. And it's really hard to take that incredibly emotional hat off sometimes, as Emily stated, just the grief and the shock that's going through our community and making sure that we put the best solutions, the most solutions as quickly and safely as possible out for folks. So that's our main goal.
Thanks, Kaylynn. Dr. Hoerneman, could you talk a little bit about how Marshfield is expanding some of its services? We talked a little bit about the urgent care and the ED, but what else are you all doing to kind of fill this need?
Yeah, the other key area we've been able to expand pretty rapidly has been that OB capacity. So we're expecting to be able to double or triple our capacity for seeing OB patients. So we've got some facility changes, should have things done in the next couple of weeks where we've been able to expand from 8 to now 21 beds. So that's been a big area of focus. We're also looking at other things that we can continue to work on and help meet the needs of the community. But the ER, the urgent care, and then those same day access appointments through the primary care and other offices have been the areas of focus to date. And then as we kind of see what the steady state is here, as things have been winding down over the last couple of weeks, we'll get more information on where the needs are and how we can meet those.
And Dr. Helmers, how is Mayo Clinic kind of responding, and what services has it opened up beyond what we've already talked about to help meet these needs?
Yeah, thank you. So in our Northwest Wisconsin region, in addition to the hospital here in Eau Claire, we have our 4 critical access hospitals in Barron, Bloomer, Osseo, and Menominee. We really work as one hospital, 5 doors. So we have expanded the capacity in our critical access hospitals to accommodate an additional approximately 25 patients before we've increased the staffing capabilities at those critical access hospitals. We've also been working closely with our Mayo Clinic Health System colleagues in La Crosse, and they have accommodated patients from this area, both on outpatient and inpatient basis, as they've had increased capabilities. As we mentioned before, we do have our advanced care at home, or our home hospital program that we have enhanced through this. And we have developed this primary care on demand so that many patients are available or capable of getting primary care through the primary care on demand product that we have marketed in the Mayo Clinic Health System.
Got it. So Mike, you had mentioned earlier about looking at some of the long-term solutions to the situation, including the potential of building an independent community healthcare facility. Can you talk a little bit about what you see as the need for that? And I guess, could you also maybe address, one of the issues that HSHS has noted is the local market competition posing a barrier for them continuing to offer services. How do you kind of grapple with that?
Yeah, well, I really can't comment on HSHS. We tried to talk to them and try to get access to their numbers and data and see what trends were going on. So they would have to speak for themselves on that. I guess my thought relative to that is based on the commitment and passion of the local leaders that are part of the cooperative, the commitment of the independent physicians, which represent 35 to 40% of the patient population in terms of people they're taking care of in their offices and primary care and ultimately specialty services, and input from many of the rural hospitals. I'm very familiar with many of the rural hospital CEOs through my work with the Rural Wisconsin Health Cooperative. When I was at Monroe Clinic, we were part of the cooperative. So I know many of those people, and I've called many of them and talked to them, and they're saying, we need a place to transfer sick patients. We can't get them in. And even I talked to one, I said, well, what about the Twin Cities? That's sort of it's west of Eau Claire, this place. And so we can't get them in there. So that's that gap. The short-term things that Dr. Hoerneman and Dr. Helmers will help, but they're not permanent solutions. People from that region, there's no need for them to go out of the area for services that the population base can support. And I mentioned the numbers, as short as a year ago, there were 35% of the inpatients in that region were taken care of by the HSHS hospitals. One rural hospital I talked with just in the last 6 weeks saw an increase of 35% in OB, basically moms to be saying, I'm going to come there. This was 100 new deliveries, which is a tremendous increase for a small hospital. And on one hand, they're saying, well, we'll do what we can with that. But these are people that are in the Eau Claire, Chippewa Valley area who would have come to Sacred Heart and have chosen to go elsewhere, either because of capacity or personal decision or whatever. And we need, so the cooperative is looking at long-term. We're going to try to see what we can do short-term, but also a long-term solution. And from an economic development perspective, I think of 1,400 jobs being lost. Some will be absorbed by my colleagues on the screen here, but all of them won't. And I look at ourselves as a startup coming to the community or originating out of the community and saying, we're going to bring 500, 600, 700 of those jobs back or retain them as a startup business, locally owned and operated. And I just think there's a great opportunity for great success with that type of model.
So Mike, given your experience working kind of in rural healthcare, I'm kind of wondering, like, kind of a bigger sort of picture idea. Like when we look at the state as a whole, last week, the Department of Health Services Secretary Kirsten Johnson at the Governor's Task Force on Healthcare Workforce warned that this situation may be a canary in the coal mine for Wisconsin in general. And these are some of the first general hospital closures that we've seen in the state in more than a decade. Are you concerned about that too? And kind of what are the broader challenges that are facing rural healthcare here? I mean, do you expect that this might be like a warning sign for the industry at large?
Well, there are many issues, and we could talk hours about payment and access and workforce, all of those issues that we're all dealing with every day. I don't know that there's been a situation like this really anywhere in the country where two hospitals of this scope are on 90-day notice. So this is a big deal relative even to the national scene. I think if what healthcare needs to do is be more creative, we need to have an engaged workforce. We need to have processes that work for patients and physicians and staff. And I think in our role with the cooperative, we can put together a program and a service that will serve the community well and be cost effective in today's market. Another thing that I've heard from the employers in the area is they have great concerns about losing HSHS from the marketplace in terms of keeping everybody competitive. Self-funded employers, they see the bills by payer or by provider, who charges what and how much things are costing them, and they have great concerns about providing a cost-effective option. And that would be part of our mission, particularly being locally based with local decision makers at the helm.
Thanks, Mike.
So yes, I am optimistic about the future, but we have a lot of work to do. And soon we'll be able to talk more about where we're headed.
Awesome. Thanks, Mike. Dr. Hoerneman, could you talk a little bit about, do you see the need for another independent hospital in this area long term?
Yeah, I think that's a good question, and I don't think we know the answer to that quite yet. And if the answer is yes, then I think the challenge is how to make that sustainable and not have some of the same factors that were affecting HSHS lead to another hospital being stressed. Part of the issue with healthcare right now, as Mike was alluding to, is there's a lot of factors out there that make healthcare not easy right now. There are many challenges stemming from reimbursement, which hasn't kept up with inflation. So particularly those safety net type hospitals, those that see patients that are come in regardless of their ability to pay and are getting services, be it for mental health, be it for emergency department care. Those are expensive services to provide, and the cost to care for those patients is not fully reimbursed by the governmental payers, which largely those patients have. And so it's a real challenge. And so that's not an easy issue to address. You know, some of that can come through adjustment of state Medicaid rates and that sort of thing, but that takes time. It takes a lot of effort, and it's expensive for the state as well. But I think that would be the key, is we would have to figure out that sustainability piece and really being part of that safety net for the community and being there for all patients.
Thanks. Dr. Helmers, could you weigh in on this too? I mean, do you see the need for another hospital in the area to accommodate the patient demand? And kind of what are some of the challenges that are facing rural healthcare providers right now?
No, thank you. And I would largely echo Dr. Hoerneman's comments, and that I don't think we know yet, because I think we need to sort of decide and see what the long-term impact of these closures are, and what our colleagues at Marshfield and at Oakleaf and Mayo, what we can accommodate. So I don't think we know the answer to that yet, but I would just echo the challenges that exist to all healthcare organizations that Dr. Hoerneman pointed out, as far as challenges with workforce and challenges with reimbursement, and having financially sustainable decisions. And I think those will be the challenges going forth as to how care is provided for all the citizens in Eau Claire.
Thanks. Senator James.
Can I just sneak in one comment?
Sure.
What we're talking about with the co-op is not HSHS version 2.0. We're talking about a new approach based in the community, laser focused on community needs and service. And all parties in the community need to address the payer issues, which are significant.
Thanks, Mike. Senator James, I wanted to just follow up with you actually off of something that Mike had mentioned in terms of the rather short notice that HSHS gave of these impending closures. Are you looking at the legislative level on any kind of bill or policy change that would require more of an advanced notification, or any other sorts of policy changes that you feel are warranted because of this situation?
I think the closure in western Wisconsin has opened up legislators' eyes across the state. I saw a report last night that the hospital CFO report dated 2/14/24 states that 418 rural hospitals are vulnerable to closure this year. There's things that we legislatively could possibly look at as far as the vulnerabilities and the indicators shown looking at hospitals. I'm not an expert in this field. This is obviously a learning environment. As far as a 60, 90-day closure, I know that some states, I think Minnesota may have a 6-month notice. Legislatively, I think in their statutory language, I don't know if this would be something that would be helpful or not. I mean, these are the discussions that initially are taking place in asking the healthcare experts if this would be something that they deem necessary. And if they do believe that it's something that's necessary, I would be the first one to advocate for it and be a co-author on it. So we really rely heavily on the experts, and I'm not on the Senate Health Committee, but I usually go to those people on the health committee to have these discussions and ask for their opinions and viewpoints. So legislatively, is there long, hard discussions that we need to have for our state moving forward? Absolutely. You know, Senator Mary Felskowski is one of them that has said this from the get-go. And I think going into the next budget session and the next legislative session, we'll be looking at some legislation for sure.
So we're fast running out of time, and I kind of have one final question I'd like folks to weigh in on. I guess the concluding question is kind of, what is your top ask for help to address this crisis? And I'd like everyone to kind of weigh in on it. So Senator James, would you like to start?
Yeah, I think thanks everybody for being here. I definitely took notes as the Dr. Helmers and Dr. Hoerneman and Mike Sanders was talking. This is how we learn as legislators. And I think that having further discussions, and I actually text my staff and said I'd like to have a sit down Zoom with Dr. Helmers and Dr. Hoerneman and Mike Sanders and have further discussion as far as what do the plans and proposals look like. Let's do what we can to help expedite this. I'll be the biggest advocate here in Madison to get meetings with the co-chairs and joint finance, have discussions with them, and let's get this money out to the people in the Chippewa Valley so that we can provide the services that are needed. This was supposed to be part of the solution, problem solving and providing solution to the people. And, you know, I don't want to make this political, but let's just do it and take care of our people. And that's where I stand on this as we navigate forward. But I need to see the plans and the proposals and have those discussions so that I can advocate.
Thanks, Senator. Kaylynn, what is your top ask to help address this situation?
It's a really a hard question, and I thank you for at least posing these questions to all of us. Everyone's view is likely to be incredibly different on what the top challenge is going to be to tackle first. Ours is to continue to listen to the patients of our community and figure out what best avenues there are for bringing care here so that we do continue to grow the Eau Claire area, specifically on the chamber side, but of course our region. We want to make sure that our employers feel safe in staying here, new business decides to come here, our citizens feel happy here and safe here, and of course have the best health care.
Thanks. Mike, what is your top ask?
What I'd like to see, I guess, is access to continued conversations and collaboration and recognition of the voice of the community through the collaborative and the independent physicians that are such a big part of the healthcare fabric of the Chippewa Valley, and that we continue these discussions in partnership and come up with some community-based solutions that will work for the long term.
Thanks. Dr. Helmers, what's your top ask?
I would, first of all, want to thank everybody on the screen and thank all the people that are listening to this. Eau Claire really is a special community and has really come together through this crisis, and it's just very impressive. And so my ask is that the community continue to stay involved and interested in helping us get through this as best we can.
Thanks. Dr. Hoerneman?
Yeah, and I'd echo Rick's comments there. Thanks for putting this on, Sean and team. I would ask that we continue that dialogue and discussion and look for those long-term sustainable changes to supporting healthcare, both in the Chippewa Valley and then beyond, and keep this from happening in other communities as well. We look for those changes in ongoing reimbursement that we can continue to support the communities and make sure that we're there for the patients.
Thanks. And Council President Berge?
Thank you. And thanks for having me on, and thanks for all the panelists as well for being here. And I guess I kind of echo what I was just hearing, that there's kind of short-term and there's long-term solutions. And I think for people to be patient, I know people want, even there's the congressionally directed spending is open right now, and we can apply for that at the federal level, but it's kind of like we're just in a hard spot because like we know we need funds and money, we just don't quite know what for because we don't know how it's all going to land. So it's hard to come up with a plan when you didn't think this was going to happen. So just that patience and just continue to have an open ear to us at the ground level of like, this is what we're seeing and hearing. And then I think like what someone just said, I don't wish this upon anyone in our state or in our nation, what we're going through. So if anyone can prevent this, a hospital just closing overnight, I mean, they don't allow energy companies to do this. You can't shut off someone's heat in the middle of December. And yet this is happening to our healthcare patients. So something, I don't know what that answer is, but this is not okay how this landed in Eau Claire, and we're all scrambling and it takes us away from other important work. So yeah, if there's any magic wand to help fix that, that would be wonderful.
Thanks. And again, thanks for all the panelists for participating. I know you're all very busy and this is a constantly changing situation. So thank you all for making time for this. Our next event is going to be April 18th in Madison with Aspirant Health CEO Matt Haywood. And yeah, thanks again for everyone for participating and for attending, and have a great day.
Thanks, Sean.
Thank
Good
you.
to see everybody.
Yeah.